Good evening. Welcome to Doc Talk. My name is Janie Crane, and I'm the Executive Director for the Island Hospital Foundation. We are coming to you live from the Anacortes High School Digital Media Studio. Many have asked me recently how they can help the hospital and how they can help our community. Tonight's program is part of the Well Journey Adventure, which is a week-long virtual fundraiser where we are raising funds for Island Hospital's new Health and Wellness Center. We all know that health and healthcare is complex. And to be healthy, to be well, requires an amalgamation of good genetics, good environment, and good lifestyle decisions. For some, this is easy, but for others of us, not so much. A healthy community is only as healthy as the sum of its parts. So Island Hospital's new Health and Wellness Center will provide educational tools and resources that will elevate the health and vitality of our entire community. In an age when healthcare must be proactive, the Health and Wellness Center will deliver on Island Hospital's commitment to quality care and quality outcomes, while at the same time enhancing our region's focus on quality of life. The Health and Wellness Center will enable Island Hospital to expand its community education programs. It will have flexible space to host classes, health screenings, support groups, even mental health group therapy. What I mean by flexible space is that the walls can retract and expand depending upon the size of the group. A key feature of the Health and Wellness Center is a teaching kitchen. This teaching kitchen will empower community members to make dietary modifications through hands-on cooking demonstrations. But we need your help to make this happen. By making a financial contribution tonight, you can help this center come to fruition for your community. Making a donation is so easy. Go to islandhospitalfoundation.org/welljourney and click the donate button. Before we start tonight's program, I would like to take a moment to thank our sponsors, especially our wellness sponsor, Marathon Petroleum. Because of the generosity of all of our sponsors, tonight's program and all of the programs throughout the Well Journey Adventure is of no cost to you, the viewer, and ensures every penny raised goes to the Health and Wellness Center. I would also like to thank the Anacortes High School Broadcast Club for filming and producing tonight's program. And on that note, I want to let you know that the current COVID-19 protocols are being followed by those on and off the camera in the studio tonight. And finally, I would like to thank tonight's panelists, Dr. Frank James, Dr. Lindsay Newlin, and Dr. John Peterson. Their expertise and compassion are gifts to our region, and we are so lucky to have them in the studio tonight. Tonight's discussion will be moderated by the Island Hospital Foundation Board President, James Tangaro. Now, without further ado, please welcome our panelists.
Thanks, Jamie. As she said, I'm James Tangaro. I'm the general manager of Marathon's refinery over on Marches Point, but tonight I'm here representing the Island Hospital Foundation Board. I serve as president of the board after 5 years on the board doing various things. Why did I get on the board? That was a question Janie wanted me to answer, and it's pretty simple. When we moved here, my wife and I, in November of 14, we went to a Island Hospital Gala, a fundraiser, one of the first things we were invited to. And we learned about what the foundation was raising money for that year with the hospital. And it was a mental health program. And it really struck us, the great need of mental health in the community and to fund it. And we got behind the foundation, and I was very anxious to join and be a bigger part of that and learn more about the hospital. And as I've done that, I've become more and more dedicated to that cause and helping the hospital and having a great hospital right here in Anacortes. So that's how I got here, and it's just a pleasure to be here tonight to moderate this and introduce 3 great doctors that work at the hospital and introduce a great new concept, the Wellness Center, that we're hoping we can make enough money to fund and make the healthcare in the community even better. So without boring you about me, let's talk about the talent, and let's talk about what we're going to do with that center. But first, I think it'd be good to introduce each of you, the doctors, and talk about your background a little bit and the work you do in the community. So I'll start with Dr. Lindsay Newlin.
Yeah, so I'm Lindsay Newlin. I'm a family medicine doctor here in Anacortes, and I do full spectrum care. So I see babies through the elderly, or older adults, I should say. And I do inpatient medicine and obstetrics as well. And I've been here for nearly 5 years, so I'll be here 5 years in October. So
That's great.
me.
So what clinic are you associated
So I
with?
work up in Anacortes Family Medicine right now.
Okay.
Yep.
Great. Thank you. Thank you. And Dr. John Peterson.
My name's Dr. John Peterson, and I've been here in Anacortes since October 2019. Moved up from Olympia. I was raised in Seattle and went to undergrad locally in Seattle, and have enjoyed returning to the Puget Sound area, especially up here in the northern area. I have been in family medicine for about 30 years now. Enjoy the full spectrum of family practice, which has been exciting to take out to our new clinic out on Orcas Island, where you pretty much are the show in town. So you get to do pretty much everything, where sometimes in a bigger hospital or bigger setting, not necessarily Anacortes, family medicine is not necessarily, you don't get all the opportunities to do everything that you were trained to. So I was lucky to be trained in Barre, Massachusetts, a rural program that very much is similar to Orcas Island, but is not on an island. So it's been fun to transition up here to the Anacortes area in Skagit County, and my wife and I have moved up here and really have enjoyed becoming part of the community. Unfortunately, COVID hit within a couple months of moving up here, so we haven't been able to enjoy all the wonderful festivals and all the other things other than the great scenic landscapes that we have to offer. So we're really looking forward to hopefully this summer with the local area opening up and really enjoying the local area. So happy to be here.
Yeah, that's great. It's a great place to be. Great place to be. And last, Dr. John, no, not you, Dr. Frank James. Sorry.
So I'm Frank James. I've been around the community here for a long time. I've been the health officer out in San Juan County for 30 years. I trained in family medicine at the University of Washington. I'm interested in research, teaching, and medical practice. I'm currently helping to run a phase 3 COVID vaccine trial for the Novavax vaccine in Native American populations, and starting a new study on the morbidity associated, not the mortality, but the morbidity, the illness burden that will likely be kind of a wave of its own after this pandemic is over. There are many areas of cardiac, pulmonary, and neurologic conditions that are related to COVID, so I'm doing that. In addition, I recently signed on as the medical director of the new clinic on Orcas. Really happy to be working with Dr. Peterson and the other partners out there. It's an exciting time on Orcas to have really a first-class clinic. There have been various attempts to do rural medicine there. This is the first time there's been the full, unwavering support of a local hospital, though. It's really going to make a big difference in the after-hours call coverage, in the availability of specialists, in the ability to really staff fully a primary care program that is so independent. And as Dr. Peterson said earlier, anything walks through the door. It's not an urban practice at all. Can and do walk through the door. My interest has really academically been in health promotion and disease prevention for my whole career, and that's where I've done my publishing, and that's where I've done most of my work, both in the United States and abroad. So I'm really excited about this program, a kind of health and wellness program, and a focus on prevention. It's incredibly important. It's the real way that we should be providing health care and not just disease care.
Yeah, that's a great point, and we're going to get into that in a lot more detail. But all of you have talked about the broad spectrum of the people, both ages and things that you treat, and I think that's interesting, because I thought medicine maybe was a lot more specialized, but you know, Dr. Newlin's treating babies to people my age. We won't say elderly again, maybe, but people my age, and everything on Orcas Island. So for Orcas, just for people that may not be familiar, I mean, how many people live on Orcas?
There are between 4,500 and about 5,000 in the winter. In the summer, it's probably at least twice that many. And that's one of the challenges out there is we have a fair number of people that are only there seasonally. And that creates a lot of challenges in doing acute care medicine that's really not primary care, where you don't have that health promotion disease prevention focus. Whereas with our full-time clients, we really want to make sure that we provide comprehensive preventive care as well as acute care.
Right. And I would ask, Dr. Newlin, with that age range of people that you treat, what is the hardest age of people to get to come see you?
I would say most males between the age of 20 and 55, I rarely see
I knew
in
you
my
were going
office.
to say males. That's why I asked age. Yeah, so
Maybe, yeah,
We're all
30,
shaking
50,
our heads,
somewhere in
yes.
there.
Yeah, so-
yeah. Yeah. Exactly.
Well,
It's more often it's a my wife told me I needed to come see you type of appointment there. Yeah.
right.
Yeah.
So probably that group is the most likely not to seek preventative care
Correct.
and could probably benefit from it the most.
One brief story about it. I had a friend, and I bugged him about getting his colonoscopy, and he kept telling me he was going to do it. And at one point, I get this report in the mail, and it basically is a CT scan of his abdomen showing widespread metastatic disease. And he didn't want to send it to the doctor because he didn't like doctors, so he sent it to me. And so I have to go to his house, and I have to explain to him, Dennis, you got a month to live.
Oh, wow.
You're going to die. And I really wish you'd gone and gotten that colonoscopy. And he made me promise at his funeral to stand up and explain to people that he was requesting that they get that taken care of. And
do your preventative care.
it was the hardest speech I've ever given.
Oh, I bet. I bet.
But it's so important, and it's so easy not to do it. Men in particular, I got to say, women are much, much better.
So you've got that situation where we're tough to get into the doctor, that age group and males, and then you have the pandemic that hit, and I believe that's also had an impact on people wanting to come in and people taking care of themselves. So let's ask a few questions about that, about how the pandemic has influenced the community's ability and desire to seek care. Can you address that, Dr. Peterson?
Well, I think, first of all, I think we're really lucky in Skagit County and Anacortes that we kind of dodged the bullet a little bit. I mean, our positive rates were pretty low overall. So I think that's attributed to the community paid attention, they wore their masks, they washed their hands, and they socially distanced. So that was, everybody jumped on board early, and we did pretty well with that. And I think that was really good. Now, in terms of getting general care, it was kind of hard in some places, especially elective surgeries and that sort of thing. If you had an orthopedic injury, a meniscus tear, and you needed arthroscopy, everybody pretty much shut down orthopedic care because it was non-essential and that sort of thing. So it was kind of, I don't know if you want to call it eerie or ironic, but here we are in the pandemic, we had to kind of furlough people. We shut down services a little bit. And that, that's kind of, in a way, doesn't kind of make sense.
Counterintuitive,
that sort of thing.
sure.
So it was kind of hard to get a lot of the preventative care, the wellness, the focus on preventing disease during this past year. Now, in general, though, there was also a fear of coming to the hospital because that's where all the sick people are, and they didn't want to get exposure histories. But I think that we did a great job on screening people at the door. I think the educational and just trying to get the communication out to the patients, to the workers and staff to make sure that we practiced what we preached and that we were able to do plenty of preventative measures. So in terms of, I really wasn't out in Orcas during this major part, but I know it was hard, especially with getting some of the patients. We had a really big challenge with behavioral health. I mean, there's a lot of mental health challenges this past year, and it's a numbers game. We just didn't have the providers. So the hospitals come up with the BHIP program, which has been a big help. It's kind of a transition that allows the primary care providers to work with the psychiatrist and a social worker and get them introduced into the behavioral health system early on so we can kind of address those needs before they become a major problem. I would say, though, just to speak a little bit about Orcas Island, there was I've only been out there 6 weeks, but there's been some issues. I worked with some major depression in the elderly, for example. There's been some issues there, but just getting, the challenge was it wasn't really available because everybody was pulling back in terms of the services they offered. So screening for colonoscopies, for example, I think we've tried to reintroduce that now at the hospital, but they're so far behind because they didn't do them for several months, and that really affected the waiting time. So that was probably the biggest chance, is that we just kind of, it was hard to get non-essential surgeries in that review. So it was a little bit harder to get things done.
Right. Dr. Newlin, do you have experiences with people not seeking care or things that you saw?
Yeah, a lot.
Unfortunately. Yeah.
I think that it's pretty apparent even when people are just walking in the door and getting their vitals done when they're coming in. They're shocked to see their weight on the scale, and they're shocked to see their blood pressures because they haven't been into the office for a year and a half and haven't been tracking it at home. And so we're seeing big, people that have never had blood pressure issues that are now hypertensive because, they just kind of didn't take care of themselves for a while.
Just being shut in.
Yeah, so those are some basic things. And then, I myself and my colleagues have seen a fair number of cases of, more advanced cancers and, for the more extreme side of things coming through the door that probably would have been caught, a little bit earlier if people had been more willing to or wanting to engage in healthcare. And maybe not, but, one would hope it could have been. And then the mental health side, I think, is huge. And I think a lot of people have been suffering throughout the pandemic and kind of feeling like, well, everyone's suffering, why shouldn't I be? And haven't been seeking support for that when really, they can and should.
Yeah, and should,
Yeah.
right.
And you see more kids than I do, but I think one of the pediatric wellness exams,
Yep.
a lot of
yes.
vaccinations in terms of the routine, the other non-COVID vaccinations kind of fell by the wayside because parents didn't want to bring their kids into the hospital. So that's we're playing catch up with that now.
And a lot of developmental delays and social emotional development
Yeah, I didn't
kind
even
of
thought
stalled
of that.
out. That's been a big issue.
So we need to get people back. And I would think, on an island like Orcas, where it's a little bit more isolated, maybe you had more mental health issues or more isolation problems, or what do you think?
Islands have pretty resilient people, but it's definitely a problem for sure. I think you got to be more resilient to survive there in the first place. I would second the issue that vaccines are a huge deficit. We're headed into this fall where kids haven't been immunized for COVID at all, so that's a priority. Mm-hmm. At the same time, 15, 20, 30% deficits in other childhood immunizations for HPV, for meningococcal vaccines. Some of the less common vaccines have been particularly hit hard that people see as kind of optional. Mm-hmm. But there's going to be a very dramatic challenge to get kids immunized in time for school. Mm-hmm. And we already have measles outbreaks, we already have pertussis outbreaks, and that's a huge crisis. And I think particularly the public health programs, both in the islands and here, they're hard pressed to get those things done anyway. Yeah. And I think with the big deficit and the challenges, I think we could easily see outbreaks of those diseases, and that's just going to put, and the public health teams, I can tell you, are exhausted. They've been going 14 hours a day for 16 months, and that's you can't keep doing that.
No, that's a lot to ask.
And so I think the combination of your infrastructure being really worn out and this big deficit in things like immunization and child care, because kids come first, I think, for almost everybody. That's what you want to do, and it's a really big challenge is coming up.
Well, that's going to be a challenge. I think that's one way we can break into this new center a little bit and try to get more space available, more services available. You guys all talked very well about prevention, and I don't do the same job as you, but one of the things I do at a refinery is I do preach to the people. We need to keep our problems small. Mm-hmm. We need to be out looking around, and we need to see if a pump is going to break. We need to know it early and shut it down before it's a catastrophic sort of a failure. Mm-hmm. So preventative care, preventative maintenance, I see a lot of commonality there. You can't let that go, or you'll lose your machine, so to speak. And if the machine's a person, that's pretty bad. Mm-hmm. So I think if we can get this wellness center up and running, and we can talk a little bit about what that's going to offer, it will help. One thing Island Hospital provided to our refinery a couple times, and I don't know if you all were involved, but we'd bring people out to do a health fair. And all the preventative stuff that we could think of, diabetes and balance and nutrition and skin cancers, that we'd have employees come in and just see all the services that were offered. And a lot of times they were blown away because they didn't know Island Hospital offered any of that, or that they could get that care so easily. So I think, building on that and having this health and wellness center that will not only do the preventative stuff, but also help you deal with, if you have a chronic condition, will be a huge thing. I think when I think of, one of you mentioned the diet part of it, or nutrition and battling diseases and being healthy. That test kitchen is going to be wonderful if we can get that built and show people, how they can eat healthy. So anyway, I've gone by I've been told not to call it the Napa building anymore. We have to call it something different. That white brick's got to go away, and it's going to be the wellness center. And looking into that, do you think, well, I'm thinking about how it will be used and how that we can get the word out for people. So the public health connection to wellness and prevention and chronic care management, open a center like that, Dr. James, do you think that's something that will sell, that people would come to and flock to when it's outside of the hospital?
Well, when you look at behavior change, the key thing isn't to tell people, is to show them and to let them do it. So I think the concept of a model kitchen with the kind of training and expertise and the facility there is a brilliant idea. Because you can tell people that's not the same as really showing them how to do it in terms of food preparation. It's really easy to eat healthy, but you need ideas. You need to know what to make. The wife needs to know what her husband's actually going to eat, and get some practice at that. And so just talking about it isn't enough. Showing and doing and giving people the opportunity to do it themselves, that's the real way to teach. That's how you make real behavior change. And as was said earlier, people have gotten overweight. That impacts a lot of stuff. And I think the overall screening aspect of it, I ran a corporate clinic for a couple of large businesses in Bellingham, and we screened everybody, and we found men, all 6 of them. We found 6 men that were either diabetic or pre-diabetic, hypertensive, and hyperlipidemic. Mm-hmm. They were the future strokes and heart attacks. They were, because they hadn't been to the doctor in years. Yeah. But we screened them, and within a couple of months, all of them were perfectly tuned up. They were all totally normal. Yeah. But it didn't take much effort at all. But if you don't know about it, you can't fix it. And so by able to have those kind of screening activities as well. So I think the wonderful thing about the concept of a building and a teaching kitchen is that it teaches people and shows them how to do it. And we can offer those kind of activities that would allow for population-based screening. And there are those of us, like some of us sitting here in the chair, that might defer care, I mean, as thoughtful as I think I am about it, I had a squamous cell carcinoma right here on my cheek, and I knew it was, and I put it off for 4 months before I went in and got it taken off. It's kind of
one of those males.
It was kind of my pet, But, well, I was pretty informed. I knew it was unlikely to cause a big problem, but I put it off for 4 months. It's like, that's stupid. There are other things that you can't see coming that I think you really want to prepare for, the colonoscopies and the other preventive care and the well child care. But I think talking about it isn't enough. I think we really do need to be in the community and really do need to show and let people try to make different meals. There's lots of good quick meals that are easy.
And how often do we tell people in clinic, you need to work on a healthier diet, but to be able to show them that is going to be way more, influential and beneficial.
Yeah, I think the visual, they talked about the example of the video I saw was, there's a receipt from a grocery store for like $10 or $15, and they cook a meal for 4 people. Cheaper than McDonald's.
Yeah.
But
it's a lot better.
I think it's always a better way to learn about the whole process and retain it. I know probably all of us hate role playing and interviewing and that sort of thing, but you tend to learn the most when you go about and do it. So I think if we can provide that opportunity for the patients, then it'll just make it easier for them to transition that behavior to the home environment.
Oh, that's a good point. That's a good point. So the kitchen is going to be important. Do you see other areas that this center
I'm
could
going
offer?
to make that pitch for the gym.
Oh, yeah?
So, yeah, with our CEO. And then maybe a diabetic wellness center type of thing, because that's been such a explosion. I mean, I'm a type 2 diabetic, so it'd be very interesting to see if we move into that and assist with overall comprehensive care with diabetes.
Oh, that'd be great.
And I think group visits would be great. You know, there's a lot of opportunity for, you know, group counseling type things for, like, you know, anxiety and those types of things that people can benefit from hearing other people's stories. I know a lot of places even do group OV visits where they have, you know, all the women together that have the same general, you know, gestational age or for how far along they are in their pregnancy, so that they can all kind of talk to each other about the experiences they're having. So there's
Right.
lots of opportunity just with having a larger space for people to be together.
Yeah,
I
it's,
think too.
feels a safe space, and you're meeting common people with common
Yep.
issues.
Mm-hmm.
Right.
You know, I saw a diabetic today, and he was really kind of depressed because he had diabetes. He had some swelling in his feet, and he had a lot of things that were limiting his mobility. But I said a funny thing that I say all the time. He says, you know, the treatment for diabetes is diet and exercise. And he kind of looked at me like, no, it's my insulin.
It's my medicine, yeah.
And what people don't know is insulin makes you hungry, you know, and you put on weight. I mean, it's
It's an anabolic hormone.
it's sort of a
Oh,
deal
wow.
with the devil where you spiral down, you know, and the treatment really is diet and exercise. And it's so hard for people. People, they kind of want to make the deal with you. You take care of my diabetes and I'll just go do what I want.
Yeah.
It really is on
look
them
at
and
the
us as
example.
providers to get back to that diet and exercise piece effectively. And I don't think it just works to tell them. You know, I think this concept of a kind of a public kitchen, if you will, and to get expert people in there teaching things that are tasty and easy and inexpensive, really important.
Right, and maybe with a group of, maybe you get a group of people to go to the gym
Right.
and work out together.
Well, that's been
you
shown to
know.
be beneficial, group exercise. But I think to follow up on Dr. James's thought there, though, is I think getting to a point where you can convince the person it's in their own best interest to take their own, to be responsible for their own health is could be part of what the Wellness Center does. I mean, it's very hard for somebody to initiate an exercise program when they're in their 40s and they've never have done anything other than high school gym class or something like that. They've never been part of a competitive or a club team. So to work, I think that would be a good component of overall health, because basically when you get down to it, as you get older, your fitness levels, your best vitality and quality of life will depend on basically how good a shape you're in. And that's the whole big picture here. So I think that would be a good portion or component of the Wellness Center.
Yeah, that's a great point. That's a great point. Yeah, so lots, I mean, just endless possibilities. Just need a few bucks to get it rolling.
Move it or lose it, right?
Yeah,
Right.
right. And I think the ability to show people and get groups together and learn by example will be wonderful. I think there's a question that's coming in from outside. I don't know, Dr. Newlin, can you read that?
Not really.
What is the first step in someone starting on their own wellness plan
Yeah, what is the first step for someone to start their own wellness journey?
journey?
Right, so I guess, yeah, anybody want to take that one? First steps?
Well, I think the first thing is always a good history and physical. Okay, to do an assessment of your baseline health. Where are you right now? Okay, identify those deficiencies or places where you have trouble with. I mean, it might be, you know, eating healthy. It might be establishing an exercise plan. You might be pre-diabetic. You might have a lipid disorder, a family history that's has some either genetic link that's pretty bad, or maybe they're have a coronary artery disease problem. So I think that would be the first step, and then moving on from there.
To get
I
a
think including in that some of the mental health side in terms of mindfulness and things, and seeing, you know, am I having a good balance in my life? Am I, you know, finding time for myself to kind of, you know, examine things, which are frequently things we kind of push to the side.
Right,
So
and I
making
think
sure
it's
that
hard to
aspect's
take
there.
that first step to go in to get a physical preventative care, and I think from what I've seen, it's even harder from a mental health standpoint. So is there anything we can do to help people with a mental health problem come in sooner? You guys see anything?
I think we all have mental health problems. I mean, I don't think it's that end stage of bipolar disorder or depression or something. I think it's really how can we become critically aware of our own true best interests and learn to act on that. I mean, most patients, they all know they're overweight. They all know that they're not eating as well as they should. I think, and there's a hunger for a solution to that. I mean, they really want to do it. There's just that little disconnect. And I think taking it to the community is a huge step forward. Because that's what doctors, we wait in our offices for somebody to come through the door. That's an old, very efficient, very time efficient, very cost effective way to do it. But at some point, you got to pony up some more money and take it to the community. And so I think that's the big difference is this is an initiative that would take health to the community. And as much as we like diagnoses and stuff, the solution's almost always the same. You got to move and you got to eat healthy. And there's some pretty straightforward things that can help people achieve their own goals if we can take that knowledge to them. And I think that's what this initiative would allow us to do.
And it's looking at it more from a public health standpoint versus an individual kind of person standpoint. I think that's important there.
Yeah, I like what you said. Maybe it's everybody's got problems to what degree is maybe the difference, but so don't be worried about
that. Though, everybody can share their challenges to taking it to the next step, and that's always going to be kind of important, I think, especially like in diabetic management. Group therapy has been helping, especially with that. Somebody might have trouble getting to the store. They might hate sticking their fingers. They may get stomach upset with metformin or something like that. So finding another way to do it, somebody else's shared experience, is going to be, I think, really beneficial for the Wellness Center. So,
I think that's a really key point, actually, is that people, examples of people that have actually succeeded. Some of the most effective teaching I do with patients, I learned from my patients. I had a whole group of people decide not to eat bread, rice, pasta, or potatoes. Just those 4 things. And all of them lost 30 pounds in 3 months. Every single one of them. And because no is easy to understand. You don't have to measure. And then it forces you to eat more lean protein and veggies. And it's my patient that brought that to me. I didn't take it to them. It's pretty. Oftentimes, that person that's doing stuff right has found a way to go for the walk every day, or has found a way to, buy food less expensively that's good for you. I mean, I think following the patients they're natural leaders. If we just need this place for them to gather to do that kind of sharing.
Great point. Great point. You see other questions up there?
Not yet.
Wait, she's typing one up. I do think, also in your case, being type 2 diabetic, when you have patients that come into you for that, it's probably harder for them to BS you a little bit, or tell you, or say you can't do this or can't do that.
It's easier for me to probably connect with them. I mean, I kind of tell them, I go, it's kind of an obsessive compulsive condition, and what I mean by that is, the more obsessed you are about your blood sugar, eating, diet, exercise, you remember those 3 things about carbohydrate content of meals, medication, and activity. I think it's a little bit easier for me to kind of share that experience with them and say, don't let diabetes control you. You need to control diabetes. And if you can, that's the take-home message, and you can leave here. I mean, then you won't have the end organ disease. You won't have problems with your eyes, kidney. End up on dialysis or have some issues with your feet. So I think that message coming from somebody that has been a diabetic for 8 years has a little bit more. They're a little bit more confident that they can do it as well.
Yeah, just an example. It can be done. Yeah. That's powerful. Well, I don't see. Well, let's see if there's another question coming in here.
Dr. Peterson, I was diagnosed with prostate cancer about a year ago, and you think about surgery, you think, maybe, it gets right down to it. It's impotence and incontinence are the 2 complications, and who wants that? Like nobody. So it was in a place and to an extent that it was reasonable to just do kind of active management, I think is the current way they talk about it. But what that meant was I got with my doctor, and they laid out, I'm a pretty active guy and I'm pretty healthy, but they tuned up a lot of stuff I hadn't tuned up myself. And my PSA actually went down. I was shocked, and it was just about improving a pretty good thing already, you know. But we all can benefit from that. And I often share that story with my patients that have a similar situation. You know, you're not, forget about the disease. Think about health, you know, and what can you do to be, and the side effects of my diet and exercise is I'm probably less likely to die from heart disease. I'm probably less likely to die from diabetes, you know. So you make these interventions and they're broad in their impact across a broad range of diseases that are very common. I mean, diabetes and hypertension, really common.
Right. Here's a question that's coming in from somebody that's doing it. It says, if I come in after seeing, after not seeing a provider since before COVID, will I have to do a whole bunch of tests, or can I do them over a stretch of time?
I think that's a bit of a negotiation with your provider and, you know, a conversation with them about what you want to do then, what you want to wait on, you know, what's most important to get done. I think any provider should be, or will hopefully be willing to have that conversation with you.
Age, status of their
Exactly.
health, you know, what their goals are in health and where they've been, that kind of thing. So
Yeah.
Prioritize.
we're not reinventing the wheel or anything like that. So it's just, I think taking, and that's part of, I mean, modern medicine now is more of a partnership with the patient and kind of looking at what their goals are and working with them and find out what we can accomplish together.
That's great. So they don't have to be scared about getting like,
Now,
you have to give a quart of blood. You gotta-
Try not to be
Yeah,
frightening.
Oh,
I
that's
was
good.
kind of shocked as a young doctor that I cared a lot about health, but most of my patients, I mean, cared a lot about disease. And it kind of gives you a whiplash as a doctor. You realize, you know, there's a lot of other things in busy people's lives. You know, their car and their girlfriend and all these other things are pretty important. And so we care about health. But most people care a lot about disease. When they're hurting, they want it fixed. You know, they'll do whatever it takes to get it fixed. But if it is health, that it tends to be a lower priority. And I think one of our jobs is to teach people that if they don't do the health behaviors, then they're going to get the diseases later on. And sometimes at a stage and in a place where you can't fix it. And so I think that's another advantage of a facility like this and a focus like this by the hospital. I mean, hospitals usually don't do this kind of stuff. This is very unusual,
Yeah.
very odd.
They could put themselves out of business
But,
if everybody, but that won't happen.
well, there's plenty of business out there. I know in a busy primary care practice, the problem is not having patients. The problem is really managing the many problems that somebody presents with and trying to get the most important ones dealt with. We'd be happy to have fewer problems.
Yeah.
Yeah, you guys
And
have
there's plenty to do.
tons to do. Right. Well, hopefully we answered that question. The next one says, can I have all of my preventative tests done at Island Hospital? Sort of an open-ended big question, but all of my preventative tests.
For the most part,
For the
yeah,
most
you
part,
can get
yeah.
everything. I mean, if they're not a complicated workup or anything like that, I mean, you can get a colonoscopy, I mean, mammograms, CT, you know, screening for lung cancer if you're a smoker, that sort of thing. Most of the
Labs,
lab
certainly.
work,
Yeah, all the blood work and things like that.
all the basic stuff.
And we were fortunate to get a new x-ray machine. We've got a digital x-ray machine, a fraction of the amount of radiation of a traditional x-ray machine. So
Oh, wow.
it's 30%, I think, is all the radiation. So we're lucky to have, you know, for a little place, it's nice to have that kind of capacity. I mean, and we thought in the past they've ordered about 2 x-rays a day. Now we can do 8 or 9. One day we did 14 films in one day. And you feel good about that because the radiation is so much less, you know.
Right, you don't have to think about the harm part of it, just the
And
finding information.
have an island hospital as a partner too, being able to get all those services in a rural, remote place is really important. And what they're doing to set up the kind of a social worker and somebody to coordinate care to get here on the ferry and be able to get home, that's a complicated thing. Really appreciate that partnership. It's something the university couldn't do, and it's something that Island Hospital can do and do effectively.
Right, and I think that one-stop shop scenario, I think, is attractive to a lot of people. If I can come in and get my stuff done, and go see my primary care doc, but I can also get any tests done that I need to get done at the same place, is attractive. People are short. Yes, without having to drive through traffic.
And this initiative is actually it kind of inspired us folks on Orcas to think about, do we need a little healthcare center too, like this, that's a health focused, and we're already thinking about where can we put it, how can we fund it, you know, we're thinking about those things right now. Because I think this is, this is the time for a focus on health. It really is. I think people coming off of COVID, they've looked at death. You know, a lot of people have seen people die that they care about.
Yep.
I know when the first COVID patient that I cared about, a Native American that I took care of, wonderful man, when he died, it was hard. You know, so I think it's kind of a reality to it that we haven't had the opportunity. There's a benefit to it. This is kicking us in the hind end in a way to really think about what we really value and appreciate. And health is definitely on that list.
So use it to kickstart in a different
Yep.
way. So, yeah, good point. This question says, could this center be used in a partnership with schools to teach students how to prepare food and encourage wellness through eating habits? That one took a minute to get in focus, but I do think it could be used that way with schools. I mean, right now I don't think there's any limits on what we're going to use it for, except I'm told I can't open my own restaurant there with that professional kitchen. But as far as teaching different groups, I think that's exactly what it's going to be used for. And so starting early seems like a good thing to do with kids in school.
I wish we could turn the camera around right now and show all these kids here that are making this possible today. Right now, we're already in partnership with these
That's
folks, and
true.
they've got the equipment and the talent and the ability to take what we're doing and make it a much bigger thing. Already, they're doing it right now. I think.
I think one of the best classes I had, I was actually as an 8th grader, was home ec, you know, and it was kind of fun to, well, not only get a second lunch, but also to just learn basic food prep and just the little things that you don't pick up. And I don't know if that's available anymore at the high school level or junior high level, but I think that's extremely important, learning how to cook well and knowing important just general nutrition.
So that'd be a good thing to use it for, helping schools, right? I think, is there any more questions? I think we're out of questions. So really what we need now, I mean, we've had a lot of great examples of what this thing could be used for, converted to teach in a gathering space and educational space. Now we just need to get on the phone and get some fundraising and get people to donate some money to make it happen. And I think Anacortes is a community that will do that for sure. They'll see the value, they'll see what you guys have said could be done, how things could be better. Oh, wait a minute, my phone's ringing. I have to take this. Just a sec. Oh, it's hello, Jerry. Jerry Bardo here. Oh, you've been watching? You like the idea? Yeah, that's cool. Yeah, we like it too. We just need to get some fundraising going. Oh, you're going to help with that? Okay, well, Jerry Bardo just, okay, I'll tell everybody. Okay. Well, Jerry Bardo just threw down the gauntlet, you guys. He come up with a $100,000 pledge if we can get enough people to match that. So he's got his $100,000 check ready to tip over. We just need everybody in the community to pitch in a little bit or a lot of it, and we can get that next $100,000. So there's one excited person that we just won over. So way to go. Good job, guys.
Thank you, Jerry.
Thank you, Jerry. And with that, we'll turn it back over to Janie.
Well, you heard it here first. Thank you, Jerry and Jan Bartow and family, for your incredible matching gift. Donate now and your gift will have twice the impact through a $100,000 dollar for dollar matching gift. By making a gift in support of the new Health and Wellness Center, you will inspire better health for your community. Don't forget the adventure continues tomorrow with classes throughout the day and special programs tomorrow night and Thursday night. But don't miss tomorrow night. We have our Med Talk coming your way at 7 p.m. On behalf of the Island Hospital Foundation Board of Directors, thank you for tuning in. Go donate and good night.